Good afternoon everyone, and I welcome you all today to this show wherein I am going to be talking about a very important topic, menstrual irregularities or irregular menstrual bleeding. I am Dr. Madanki from careIVF. Before I start talking about irregular menstrual bleeding, I would like to give you a very basic definition of what is menstruation. The menstrual cycle is a series of changes that a woman's body undergoes in anticipation of a pregnancy, and this happens on a monthly or a cyclical basis. The ovaries are the organs on either side of the uterus which release an egg every cycle, and this process is called ovulation. The uterus also prepares itself by way of hormonal influence by forming a lining which is suitable for pregnancy. In the event of fertilization not happening due to non-meeting of the sperm with the egg during ovulation, this endometrial lining is then shed through the vagina and is externally manifested as menstruation. I will make this a little bit more easier for you to understand with the help of this picture here. This pear-shaped organ that we see is the uterus, and in the center is the cavity lined by the endometrium. This is the vaginal passage, and on either side we see the ovaries. The ovaries cyclically in turn release an egg every month. And in the event of the egg not meeting with the sperm during ovulation, there is no fertilization that happens, and this leads to the shedding of the endometrial lining through the vaginal mucosa, and what we see externally is called menstruation. So now it is also now important to know what is normal bleeding. Every woman's body is different, and in the same woman every cycle can be different in different months. These variations can happen because of hormonal influences, stress, illnesses, examinations, and simple things like even anxiety, change of residence, change of job, anything that can impair the hormonal influence, and this is an extremely sensitive process. Now in many women it works like clockwork, but in some there may be a hit or a miss and may be very unpredictable. On an average, a woman bleeds for about 2 to 7 days, and the cycle length may be between 24 to 38 days. Now for the first few initial years, the cycles may be unpredictable, may be prolonged, may be lengthy, and as we age, the cycles tend to get shorter. The onset of menstruation is known as menarche, and this age again can differ in different populations. The average age is considered to be between 11 and 14 years, and the median age is defined as 12.4 years. Having said this, the menarche, the onset of periods that is, can happen as early as even 8 years or maybe as late as even 16 to 17 years. So this is why it is important to keep track or to record your menstrual cycles. It is important. So how do we keep track? So that is why you should keep a menstrual calendar. It is important to keep track of your menstrual cycle because this can be a very useful tool for your consultant when you approach him for menstrual irregularities. The start of your periods should be marked on your calendar as day 1. Today, there are many apps also available which you can install in your phone, which will help you easily keep track of your menstrual cycle. The points to be noted are the starting date, the duration, the amount of bleeding that may have happened, whether there has been any associated passage of clots, have the periods been painful, have they occurred on time or delayed, has there been any other associated symptoms like nausea, bloating, breast pain, headaches and worsening of migraines, and if any painkillers have been required, and also if there has been any absence from work. This record will be very useful to your doctor when you consult him for menstrual irregularities. Now we need to know the causes of irregular periods. Irregular periods causes can be manifold, but let us start with the most common causes. First one being polycystic ovarian syndrome, or PCOS as is also commonly called. In polycystic ovary patients, which is very commonly seen in young women, the periods may be very irregular, the duration between the frequency may be as less as once in even 2 to 3 months. The periods may be very scanty or they may be very heavy too. It is a metabolic syndrome complicated by many hormonal changes, metabolic changes, insulin hypersensitivity, and needs detailed evaluation. The ovaries are bulky and may have multiple follicles in the periphery. The second most common cause is anovulation, which is also seen in polycystic ovary patients, and this may be also cause for irregular bleeding. So a little bit about anovulation. What do you mean by anovulatory cycles? In normal physiology, ovulation is very highly dependent upon a very intact and functioning hypothalamo-pituitary ovarian axis, and a chain of events unfold which is very sensitive to any fluctuations or physiological disturbances. This leads to an alteration in the hormonal milieu causing anovulatory cycles. The other causes may be pregnancy, where periods can be missed. In lactational amenorrhea, when a woman is breastfeeding, periods may be delayed and there won't be any periods as long as she is fully breastfeeding. This is called lactational amenorrhea. The other causes of irregular periods could be uterine fibroids, where the bleeding may be very heavy and prolonged too. In perimenopausal women also, the cycles can tend to get shorter, be very irregular, and become less frequent in the years to come, leading to menopause. Menopause is not a single event and cannot be just, it is not just that the periods suddenly stop coming one fine day. It is again a series of events and a spectrum wherein these changes start happening in the body a few years even before the cessation of periods. It may be as lengthy as even 10 years, characterized by other symptoms like hot flushes, mood swings, increase in weight, and this period is known also as climacteric, leading to the menopause, which is defined as stopping of your periods for over 1 year. Pelvic inflammatory diseases, which is caused by any pelvic infections and also endometriosis, may be a cause for irregular periods. So what are the types of irregularities in your menstrual cycle? Broadly, they can be classified into 3 types. Amenorrhea, which means absence of periods for over 3 months, is known as amenorrhea, and it can be primary or secondary. Dysmenorrhea, which is characterized by painful periods, and menorrhagia, or heavy and prolonged periods. What are the investigations that can be done to evaluate and get into the bottom of this problem? We need to start with a detailed history taking, where once again your menstrual calendar or your menstrual chart will be very useful for the consultant to arrive at a diagnosis as to what may be the underlying cause, followed by the very basic tests to find out whether you are anemic, whether the two most important causes that are implicated in irregular menstrual bleeding, in which I had mentioned earlier, are also hormonal, the thyroid, that is a TSH, and the prolactin. These two are very, very implicatory in causing irregular periods. So we need to evaluate your thyroid status, your prolactin, whether you are anemic, and a few other blood tests to also find out if they are. We also, in polycystic ovary patients, we also do some other tests like FSH and LH, the fasting insulin, all of which can help us arrive at a diagnosis. The next thing, that is the next investigation, which is very, very useful, is a basic ultrasound, wherein polycystic ovary can be excluded. Also, if there are uterine fibroids, if there are any ovarian cysts, which may be the cause for this your irregular periods. Hysteroscopy also plays a very valuable tool in dysfunctional uterine bleeding, and laparoscopy again is very useful when there is endometriosis, ovarian cysts, and any unknown causes. There are few more tests that can be done, but going into the depth of this is out of the purview of this discussion today and will be dealt with in detail in another show of ours. Finally, we also need to understand that the treatment should be targeted at the tests, at the history, from the history that we have taken, from the test, the results of the test that we have got. At the same time, one needs to bear in mind the age of the patient, whether there is a desire for future fertility, if she is in the perimenopausal range, age bracket, and a few other parameters will help us to decide whether as to how to go about the treatment. Treatment should start with the very basics: correction of the hormonal imbalances, lifestyle modification, dietary correction. Even a 5% loss in the body weight has been seen to improve or correct menstrual irregularities in patients who are overweight or obese, or in polycystic ovarian patients. So dietary correction, lifestyle modification, correction of hormonal imbalances, and also of course stress reduction plays a very vital role in correcting menstrual irregularities. Being alert, aware of your own body, your own physiological changes, and being informed will help you to arrive at early detection and correction of any underlying abnormalities. Thank you so much for being here with me today, and we will get into the detail of these subheadings in our future topics. So stay with us, be with careIVF, and we are there for you. Thank you so much.